More importantly, Dr. Kulvinder Gill is an Ontario paediatrician and president and founder of Concerned Ontario Doctors. This week, Australia's shadow health minister, Chris Bowen, you know, the bloke who was responsible for the lamentable grocery watch and fuel watch back in Kevin Rudd's day, and the genius who told undecided voters at the last election, if you don't like Labor's policies, don't vote for us. Good advice, Chris. Anyway, Chris Bowen, ever up to strident form, chose to attack Dr. Gill, Canadian doctor, in our parliament this week, under parliamentary privilege, I presume, calling her a zealot and a conspiracy theorist. Why? Well, because he was attempting, and failing as usual, to censor Liberal MP Craig Kelly for the comments Craig Kelly had made in Parliament the previous day.
State governments that are putting rulings in that are actually making a doctor liable to go to prison if he prescribes hydroxychloroquine to one of his patients if he thinks it may save their life.
So instead of engaging in the debate, our Shadow Health Minister Chris Bowen simply decided to smear the reputations of doctors around the world and, of course, Craig Kelly. Well, here on Outsiders, we prefer to keep an open mind, unlike Mr Bowen. And so now you can decide for yourself whether Dr Gill is a zealot and conspiracy theorist or not. She joins us live from Toronto. Dr Gill, how are you?
I'm doing well. Thank you for having me.
Well, thanks so much for coming on. I'm glad to introduce you to Australia. I'm sorry it's in these circumstances where one of our less able and competent MPs decides to attack you. Before we get into the issues, what's it like to be attacked in Canada from an Australian parliamentarian?
It's a first-time experience. I'm actually quite shocked.
Well, you look fine on it. Now, tell us your main concern. You have spoken out about spoken about hydroxychloroquine. You've spoken, more importantly, and we're going to discuss this here today, about the importance of the sanctity of the doctor-patient relationship and why historically it is so important. So explain this to us, Dr. Gill.
Absolutely. So following the atrocities of the World War II, where doctors had actually been forced to commit crimes against humanity, countries had gathered and they signed the Declaration of Geneva, and that was in 1948. And the purpose of that declaration was to then form the International Code of Medical Ethics, which demanded that physicians practice their profession with conscience. And it was to ensure the sanctity of the doctor-patient relationship from any future intrusion by government, any future violation or coercion, or any sort of manipulation by governments or its bureaucrats in the practice of the actual profession. And now in 2020, we see a very dangerous and unprecedented violation of that very doctor-patient relationship.
So what we're seeing, you're referring to hydroxychloroquine around the world in some countries like Australia, certain states. This drug, tell us about the drug in a second, but it has been literally criminalised in some of Australian states. Doctors could go to prison or face huge fines. Now, tell us about this drug and why you think bureaucrats involving themselves in banning this drug are violating those Geneva principles.
Well, it's crucial to understand that hydroxychloroquine is a safe and generic medication that was actually approved 65 years ago, and it is sold over the counter in the majority of the world, and it's actually on the World Health Organization's list of essential medications. And when used in the appropriate dose, there has been no reported cardiac toxicity in all of the clinical trials and studies done in COVID-19 patients to date. A study published recently in the Journal of Electrocardiology actually found no clinically significant ECG changes in the non-ICU COVID-19 patients when they were treated with a 5-day azithro hydro combo. And there was actually a peer-reviewed systematic publication that actually showed that HCQ is protective to the heart as opposed to being harmful. And there was no cardiac toxicity or death actually reported as a result of HCQ and the azithro combination being used in all the peer-reviewed literature for COVID-19 patients. So that review actually concluded that hydroxychloroquine should not be restricted for the use of COVID-19 patients. And I think it's so fundamental for the public to understand that hydroxychloroquine has its on-label uses for such things as malaria prophylaxis or for the treatment of certain autoimmune conditions. However, doctors have always had the ability to prescribe existing approved medications for non-indicated conditions. This is known as off-label use of that medication, and it occurs when doctors utilize their clinical knowledge in discussion with their patients in that sacred doctor-patient relationship, and they get their patients informed consent, such as treating early COVID-19 patients with the hydroxychloroquine. So it's absolutely appalling that we're seeing this unprecedented violation of the doctor-patient relationship, where we have many of the developed countries around the world that are actually prohibiting doctors and sanctioning them if it is prescribed to their patients. And such a violation, I have to stress, has never occurred before for any medication ever.
Rita.
So the discussion,
Sorry.
Yes, so this discussion has become extremely politicized. So we really need to get back to talking about the science and the logic and the facts.
Rita.
Well, it has become completely politicised. If you have someone come to you, what would you do as a doctor if you were told by health bureaucrats you are not to prescribe HCQ for COVID-19, but you had a patient who had presented early? Would you go ahead and do that? And where do you stand with your obligation to give the patient the best care possible and
Right.
then following these bureaucratic guidelines? Where does that put you as a doctor?
Well, in the majority of North America, the majority of the European countries, Australia, and in New Zealand, if doctors prescribe it, they're actually opening themselves up to college investigations. And in some jurisdictions, they're even starting to investigate doctors who are merely talking about it. They're being censored as being spreading dangerous information when they're simply talking about evidence-based medicine. And the smears against hydroxychloroquine need to stop. There's one fundamental aspect which is critically missing in this discussion. And people don't seem to realize that there's two stages for COVID-19 disease that are very distinct and different. So the first stage is when the virus actually replicates and patients experience flu-like illness. And this is the stage where hydroxychloroquine, often in combination with other meds such as azithromycin or zinc, has been found to be very effective. Studies published on the CDC website back in July actually show that over 88% of patients don't yield any a replication-competent virus after 10 days, and the viral shedding actually drops after 6 days. So this explains why those first 5 days of treatment during the first 5 days of symptom onset is so crucial. And this also helps to explain why published studies have found that hydroxychloroquine is actually most effective in the high-risk patients during those 5 days. Now, when you talk about the high-risk patients, such as a senior or a patient that has significant comorbid disease, if you begin them on treatment almost immediately, you will most certainly recover within a few days. When not treated, high-risk patients may progress to the second stage. And the second stage is where the virus can actually cause severe pneumonia. Sometimes it can begin to attack other organs, such as the heart. And sometimes it can lead to a hyper immune response known as a cytokine storm. So I think it's really, really important to stress that out in Australia, the expert panel where they say that it doesn't work, and in other countries such as Canada or the US, when these experts say that it doesn't work, they're only relying on clinical trials in late hospitalized patients. They're not examining the early outpatient data.
Doctor, Kulvinder, Gill, so fascinating to hear what you say. And there, Chris Bowen, is what you should be listening to if you want to be the health minister one day. Listen to informed opinion. And I bet you cannot find a single health consultant who will actually be able to disprove what the Dr. Gill is saying.